स्टार्ट क्या है? ठीक. Okay, silence please. Very good afternoon to you all. Yeah. ठीक. Today we will be hearing about dealing with alcoholic liver disease. Okay. A liver disease caused due to consumption of alcohol. Okay. So at the end of the lecture, you will be knowing the definition of the alcoholic liver disease, classification, and describing the alcohol metabolism and various etiopathogenesis, morphological features and clinical manifestations of alcohol liver disease. ठीक है. ज़्यादा एक्स्ट्रा वॉइस आ रहा पीछे, बैकग्राउंड नॉइस इज मोर, so you people please maintain silence because the lecture is going to be recorded. Background noise should not come. Listen silently. If you have any doubts, please ask. You can raise your hand. I will stop the lecture and I will try to clarify. So last benches, please come forward. Front benches have been so vacant. Please come forward. Okay, don't create noise. The lecture is getting recorded. Background noise should not be there. So knowing these entities about the alcohol metabolism in the liver, and it comes under cognitive domain, and it's also a must-know level of factor in curriculum based learning. So all these things, both the things comes under cognitive and domain and must know domain level. So everybody should aware of the what is alcohol metabolism, how it is after consumption of the alcohol, how it is going to get absorbed from the stomach and to the liver, and then how it is getting metabolized within the liver parenchyma. Okay? And then what is its complications after development of liver pathology. So the introduction part, you should know that excessive alcohol consumption is one of the most major cause for the liver diseases. Okay, so the disease burden is throughout globally. It is it accounts for 5.9% of all the deaths, and when it compared to other comorbidities of the liver parenchymal diseases like the diseases due to other enzymatic congenital disorders or enzyme deficiency disorders of the liver and metabolic disorders of the liver, the disease caused the alcohol per se itself is very more dangerous compared to other causes. Okay. So the definition wise, you know it is the disease caused due to the consumption of the alcohol. It is called alcoholic liver disease. And how it manifests, so it is easy to remember. The disease manifestation happens at 3 stages. First stage is alcoholic steatosis. Steatosis means accumulation of the fat substances within the liver cell. That the hepatocyte tries to accumulate more fat. That is, we will know in the coming slides, we will know how the liver cell is going to synthesize more amount of fat due to alcohol consumption. Okay, that is called alcoholic stage of alcoholic steatosis and alcoholic steatohepatitis. Next, here you know the term hepatitis. In the last class also I told you, itis means inflammation. Inflammation of the liver cell is hepatitis, and when it is accompanied by alcoholic steatosis, we label the term as alcoholic steatohepatitis, and next it will progress into alcoholic fibrosis, and then it gradually progresses into cirrhosis. So, these are the 3 different stages of alcoholic liver disease. The question for in your exam purpose, it may come as a long question also. So, you have to briefly write about all these 3 stages, and then what are the basic mechanism, and then clinical manifestations and complications of the alcoholic liver disease. Okay. So, how much of taking of alcohol is dangerous? So, it is the dose wise, it is the amount of alcohol you consume every day, or for all the individuals the dangerous limit is 80 grams of alcohol. Matlab, it is equaling amount to the 6 beers or 8 ounces of 80 proof liquor over one in a single day or many other days, consecutive days. It results in a mild reversible injury. Okay. So, anybody who is prone to get liver cell injury due to consumption of alcohol, if they take in a single day, if they take 6 beers or equivalent to 8 ounces of 80 proof liquor in a one day, they may get liver injury, showing some kind of a reversible kind of liver injury. So, this first stage of steatosis, alcoholic hepatosteatosis is a kind of reversible change. Okay. Baki, when it progresses to next stage like steatohepatitis and then progressing into fibrosis, it is a irreversible damage to the liver parenchyma. Okay. So, daily the consumption should be of when the disease manifestation is of mild, when you take that amount of liquor, that is 80 grams of alcohol. So, when you start taking daily intake of 160 grams of alcohol or more duration, like continuously if you take alcohol for more than 10 to 20 years, so the liver obviously shows development of severe liver injury. Okay. So, among statistics wise, only 10 to 15% of the alcoholics only develop cirrhosis. Okay. The cirrhosis is a end stage liver disease, no return of area. Okay. The end stage liver disease is, in case of alcoholic liver disease, is cirrhosis. And coming to the gender history, females are more susceptible to alcoholic liver disease, because the enzymatic process which metabolizes the alcohol in liver, and compared to gender wise, the females are more susceptible to get the disease, alcoholic liver disease. And ethnic wise, and if you look at ethnic and gender genetic differences, when they studied, African Americans are more risk, they show more risk compared to the Caucasian Americans. And why this genetic variation occurs in case of people? So, there must be a variation in the alcohol detoxifying enzymes. So, liver is a major detoxifying agent. Whatever chemicals, whatever toxic substances goes into the liver parenchyma, liver tries to detoxify the chemicals. Okay. Here there may be genetic variation in the digesting of those alcohol detoxifying enzymes and certain cytokine promoters, like cytochrome P450 is there, which contains a complex of enzymes which will try to detoxify the effect of alcohol. Okay. Normalcy, bring to normalcy. So, the effect of alcohol liver disease will be more when the patient is having certain comorbid conditions. Suppose if the patient is a known hepatitis B virus patient or hepatitis C virus, chronic carriers also, so they are much more prone to develop the disease severity when they take alcohol consumption. And similar to hepatitis B virus and hepatitis C virus, and certain infections iron overload like hemochromatosis and other non-alcoholic fatty liver disease also, when they are associated with this alcohol intake, the disease severity will be more aggressive in those patients. Like usually we said it requires 10 to 20 years to develop the complications of the alcohol liver disease, but when they have comorbid conditions, the occurrence of the disease severity will be more, they will take less time when compared to the normal individuals. Okay? That is what in this line says. So, now to understand what is the basic pathogenesis of the under alcoholic liver disease, we will divide it into 3 steps. Say one is depending upon the stage, like hepatosteatosis, like accumulation of the fat. So, that is the how it is happening in the liver cells and what causes hepatic injury or inflammation leading into progressing into hepatitis. And then subsequent step is what causes hepatic fibrosis. So, in this if you learn the alcoholic liver disease pathogenesis in these 3 steps, like what is the basic mechanism of causing steatosis, fat metabolisms, and then what is the results of inflammation or injury which causes results in hepatitis, and then complications of inflammation progressing into fibrosis. So, that is development of fibrosis, alcoholic hepatofibrosis. So, steatosis, hepatitis, steatohepatitis, and then fibrosis progressing into end stage liver disease, cirrhosis. These are the different stages of the alcoholic liver disease. So, what is the metabolism mechanism under initial step like alcoholic steatosis? Why this liver cell gets accumulated, increases, results in accumulation of the fat substance. So, there may be once alcohol gets consumed into the stomach. So, the digestion of the alcohol starts from the stomach itself. Stomach will have an enzyme alcohol dehydrogenase enzyme, stomach related alcohol dehydrogenase enzyme is also there in the stomach, and after reaching the liver, the alcohol substances will be converted into the acetaldehyde, okay, by means of enzymic activity of alcohol dehydrogenase. Remember this, alcohol by the action of alcohol dehydrogenase will get converted into acetaldehyde, okay, and then by using NAD. So, NAD in this step, NAD will act as a coenzyme, cofactor. This NAD will get converted into NADH. Similarly, for the next step is acetaldehyde will be converted into acetic acid. So, by the action of the enzyme acetaldehyde dehydrogenase. So, in this step also this NAD will be getting converted into NADH. Okay. So, in this conversion process you will see increased accumulation of the NADH compared to the NAD. So, there will be imbalance between the NAD and NADH. Normally functions is as a antioxidant function, NAD will have an antioxidant function. So, as a result of there is a change in oxidation status. So, there will be suppression of the fatty acid oxidation, okay, as a result of imbalance in the NADH and increase in NADH and decrease in NAD will result in these effects like decrease in suppression of the fatty acid oxidation. Similarly, at the same time you will have increased fatty acid synthesis and impaired lipoprotein assembly and secretion. So, all these 3 factors will lead to accumulation of the fat within the hepatocytes. Okay. So, accumulation of the fat in the hepatocytes is called as steatosis. Okay. So, that increases the this is the one of the cause. So, another reason for increasing the hepatocyte fat substances within accumulation is there is increased peripheral catabolism of the fat also. So, these 2 factors, that is one, that is the internal factor. Another external factor is there is increased peripheral catabolism of the fat resulting in increased circulating pool of the adipocytes. So, all these 2 factors combine and results in steatosis stage, first stage. Now, you understand, you have to remember the enzyme actions of the alcohol dehydrogenase and acetaldehyde dehydrogenase. So, alcohol dehydrogenase in that activity you will see the conversion of the NAD to nicotinamide adenine dehydrogenase to nicotinamide dehydrogenase NADH. Okay. So, similarly, in the conversion of acetaldehyde to acetic acid. So, the role of here acetaldehyde you have to remember enzyme acetaldehyde dehydrogenase. So, what will the end result is that there will be the reversible reverse in the ratio of the NADH with NAD. So, there will be change in the reduction antioxidant and oxidant ratio. So, increased oxidant stress will result in suppression of the fatty acid oxidation, and there will be, in addition to that, there will be association of increased fatty acid synthesis, and then there will be a defect in the metabolism, like packing up after synthesis of the fat within the liver parenchyma, there is a defect in making them into transport into some other area. So, as a result, the newly formed fat substances gets accumulated within the liver cell as a result, and this is the one of the internal factor reasons for increased fat synthesis within the hepatocytes. Similarly, simultaneously in the external outside environment, there will be increased fat metabolism resulting in breakdown of more fat substances, resulting in increased circulating pool. So, fat substance क्या है? Triglycerides, the LDL, HDL, so triglycerides, these cholesterol substances, these are the various fat group substances. So, what you will see increase in fat substance, triglyceride levels and LDL levels. So, HDL is a protective thing. So, there will be decrease in HDL compared to there will be increase in LDL and triglyceride levels. So, these are the various fat substances you see in circulatory pools. So, all these two factors will combine, will result in accumulation of the more amount of fat in the hepatocytes, resulting in stage called as steatosis. Remember? Okay. So, now coming to the next stage. So, next stage is how the inflammation occurs, resulting in hepatitis. So, hepatitis means inflammation of the liver cells. So, it may occur after as a result of acute bout heavy drinking similar to and repeated episodes of alcoholic hepatitis superimposed on pre-existing fatty liver. So, what you will see in microscopically, you will see there will be hepatocellular necrosis and formation of alcoholic hyaline bodies are also called as Mallory bodies. So, how this is going to get initiate the inflammation within the liver cell? So, there are mechanisms, multiple mechanisms one should understand. So, as a result of conversion of alcohol to acetaldehyde, these acetaldehydes will try to form new chemical agents, newer chemical proteins. So, they act as a chemical adducts and protein adducts. So, a new formation of newer chemical substance is called as chemical adduct. So, what this will form? They try to form newer antigens over the liver surface. So, these newer chemical substances will try to reach the hepatocyte cell membrane, and they will try to expose the environment as a newer antigen. So, what will happen? Automatically the autoimmune system of the person will come activate, autoimmune response gets activated and results in hepatocyte injury or hepatocyte damage. Like in the previous hepatitis class, we said after ingestion of the hepatocytes into the hepatocyte, it will, as the cytotoxic CD8 cells will come and result in showing the cytopathic effects, resulting in hepatocyte necrosis and then release of the various virus particles. Here similarly, as a result of the new antigen presentation over the hepatocyte surface, their autoimmune system gets activated and results in hepatocyte injury. Another similarly, the protein adducts, what they will do, the protein adducts will results in oxidative stress. Okay. So, that results as a result of lipid peroxidation, resulting in increased amount of oxidocytes, resulting in oxidative stress. Okay. Another thing is induction of macrosomes with cytochrome P450 enzymes. So, there are certain cytochemical P450 enzymes which helps in digestion of the alcohol metabolism. In that, cytochrome P2E1 is more important, which helps in alcohol metabolism. By doing alcohol metabolism, it results in increased reactive oxygen species. So, these ROS we have read in the first chapters itself, reactive oxygen species. What they will do? Generate they will try to create the hepatocyte damage, and similarly there will be impairment in the methionine metabolism, resulting in lower amount of glutathione. So, this reactive oxygen species class only you understand glutathione, GSH and all those things. Na? So, here as a result of lowering amount of glutathione, there will be increased susceptibility to the oxidative stress, resulting into the hepatocyte injury. And another thing is, with increased alcohol intake, there will be increase in the amount of bacterial endotoxins in the gut, resulting in inducing the inflammatory response, there will be increase in production of the tumor necrosis factor alpha, interleukin 6, like that. Those inflammatory response will generate. So, all these factors gets accumulated and results in hepatocyte damage or hepatocyte injury. So, this is how you will find as a result of alcoholic hepatitis. So, once again, so in the way of metabolism of alcohol, you will find the generation of acetaldehyde. This acetaldehyde will help in creation of the adducts. Adducts are nothing but abnormal newer antigens, new antigens. After formation, when they get exposed over the cell surface of the hepatocytes, they will initiate the autoimmune response. They invite autoimmune response, resulting in hepatocyte injury. Similarly, these protein adducts will help in creating the oxidative stress. And then similarly, with the enzyme metabolism of the cytochrome P2E1, it results in more generation of the reactive oxygen species, resulting in oxidative stress. Another time is because of impairment of the methionine metabolism, there will be decrease in the amount of the levels of the glutathione. So, low glutathione, which will also help exposes the individual cells to oxidative stress. So, you have to counter all these factors coming together and results in hepatocyte injury and certain similarly damage also. So, now the next stage is how this is going to create fibrosis. So, if I am understanding the creation of the fibrosis as a result of various inflammatory injuries, you have to understand the normal histology of the liver parenchyma. In the previous class also I have shown the hexagonal architecture with the central vein here. This is the central vein here, and this central vein when up towards the hexagonal end, you will have the portal triad. So, portal triad will contain all the three cells like areas, portal veins, hepatic artery and the bile duct. These three components will combine, will try to form the portal triad. So, what exactly in the anatomically we will find histologically, these are separated by sinusoidal spaces. The hepatocytes from one plate thickness, they will be individually, they will lie in a single plate. Okay. So, single row of hepatocytes will be there, cord-like structure, and there the rows of hepatocytes will be separated by a sinusoidal spaces, vascular spaces. So, these vascular spaces are nothing but they are lined by the fenestrated endothelial surface, like for absorption activity and then various metabolic activity. These hepatocytes will have a fenestrated endothelial sinusoidal spaces lined by fenestrated endothelial cells. Over the endothelial cells only you will find the stellate cells. So, what are these stellate cells? Stellate cells are quiescent cells, then they remain ideal in normal situation. So, they usually store, what they say is they usually store vitamin A. These quiescent cells, stellate cells will store vitamin A in a normal resting phase. So, during the time of fibrosis, what it shows, stellate cells will get activated by the process of inflammation. So, there are various cells, the space of, the space of Dicey, what is space of Dicey, and various cells, Kupffer cells. Kupffer cells are nothing but macrophages, reticular endothelial system of the liver cells, Kupffer cells. They are also called macrophages of the liver system. Okay. So, those are named as Kupffer cells and endothelial cells. You see, you have to know about the Kupffer cells, endothelial cells and other cells which are getting shown response to the inflammation. So, once these stellate cell, how they get activated by means of inflammation as a result of alcohol, there is a cell injury happens. So, once there is an injury to the cells, there will be inflammation resulting in inflammation of the hepatocytes, Kupffer cells and endothelial cells. So, what they will do after getting inflammation, they will try to release the certain cytokines and chemokines like transforming growth factor beta. So, these will help in try to stimulate the stellate cell. They will try to, normally they are in a resting phase like quiescent stage without doing much. Okay. So, once there is an inflammation and the inflammatory cells release the certain growth factors like cytokines, release of cytokines and chemokines like transforming growth factor beta. So, they try to activate the stellate cells. So, once these stellate cells gets activated, they will transform into the fibrogenic cells. So, these fibrogenic cells will try to progress to form the laying down of the type 1 and type 3 collagen within the damaged lobular area. So, these after transformed stellate cells into the fibrogenic cells, these fibrogenic cells will try to secrete type 1 and type 3 collagen within the lobular area, resulting in fibrosis. This is one mechanism. So, another mechanism is these stellate cells will have an intrinsic property of myofibroblastic nature. So, with this action myofibroblastic activity, what will happen? It will try to constrict the sinusoidal vascular channels. Okay. So, once it makes constriction to the sinusoidal vascular channels, there will be decreased blood supply to the area, resulting in hypoxic environment that will progresses the fibrotic process. Okay. So, simple process, simple to remember. After getting inflammation of these hepatocytes, Kupffer cells and endothelial cells, they will release certain growth factors or certain inflammatory products like cytokines and TGF transforming growth factor beta. They will go and stimulate the stellate cells which is already in an ideal state, in a resting state. So, once it becomes getting activated, they will try to transform into fibrogenic cells. So, like formation of a fibroblast like cells. So, these fibroblast cells will what they do? They will do deposition of the type 1 and type 3 collagen in the lobular area. So, you will see result, as a result you will see the development of the fibrosis in case of liver injury. Similarly, another thing is this stellate cell will also have, after becoming the fibrogenic cells, these fibrogenic spindle cells will have the both smooth muscle cell property. It acquires both contraction property. As a result of it results in constriction of the sinusoidal vascular venous sinusoidal vascular spaces. As a result, it results in decreasing the supply of the blood supply, resulting in hypoxic environment, creating further progression into the fibrotic process. Okay. This is how you results in finally leading to the end stage disease in the form of micronodular cirrhosis and macronodular cirrhosis. So, micronodules are nothing but depending on the size. If the size is less than 3 mm, you may call it as a micronodule or cirrhosis. If the nodule size is more than 3 mm, you call it as macronodule. Okay. So, depending upon the stage of the disease process, you may see in the initial stage because of fat accumulation and hepatitis stage, the liver may be enlarged and it will show because of accumulation of the bile substances, yellowish color tinge of the liver also you will be seen. So, the disease process is first described by the scientist Laennec. So, you may have also know the terminology Laennec cirrhosis in medicine textbooks. Okay. So, microscopically what will happen? So, there will be loss of normal lobular hepatic architecture. First is the loss of normal hepatic architecture, and then it forms a newer generation formation of the fibrous septae, forming another thing is regenerative nodule. So, these three things will combine together, result you can call it as a cirrhosis disease. So, cirrhosis is characterized by loss of normal hepatic architecture, and then you increase amount of fibrous bands, and then forming surrounding the regenerative parenchymal nodule. So, all these three things together makes the cirrhosis. Okay. It is a end stage liver disease as a result of many causes. So, cirrhosis will have a multiple causes. So, among them one of the causes is alcoholic liver disease. So, this alcoholic liver disease may progress into this after fibrosis stage, it will progress into cirrhotic stage, that is end stage liver disease. So, now after knowing about the pathogenesis of the alcoholic liver disease, now we will look into what are the clinical features and how the gross appearance of the liver may seen. As I already explained to you, in case of a fatty liver in the initial stage fat steatosis, the liver may gets enlarged. In the normal anatomical position is in the just beneath the rib diaphragm, you will in the right side, right hypochondric region, the liver is occupying. So, both you have right lobes and left lobe of the liver and coming to the reaching near up to the stomach area. So, we have seen. So, it is enlarged in size and this capsule becomes tough, and margins are more prominent, and the little yellowish color due to accumulation of the bile substances. So, all this is the things you have to feel. So, as I told you, it is a polygonal architecture, liver cell each this just a diagrammatic representation of a hepatocyte. You will find the nucleus in a microvesicular status. The nucleus is located in the center of the cell usually. So, and you will find multiple fat spaces, fat vesicles. So, this is results in microvesical steatosis. So, in macrovesicular status, what will happen? The size of these small vesicles of the fat gets accumulated and results in bigger size of the fat spaces, fat vesicle, and pushing the nucleus to the one end periphery. So, that will result in this kind of appearance. Okay? So, you remember these two terms, microvesicular steatosis and macrovesicular steatosis. So, this is the histopathologic section, histopath section. You can see this is a portal triad area wherein you can see the fibrotic areas and all the hepatic artery, portal vein and bile duct areas, and you can see the clear spaces. These fat spaces are nothing but the fat spaces. The larger size are macrovesicles and smaller size is a microvesicle. So, how these fats, all the clear spaces are having fat content within them. So, how to demonstrate the fat histologically in normal course. So, there are many special stains used to demonstrate the fat substances. So, for unfrozen section, this fat can be demonstrated by using various stains. You should remember the names and the color it showed on the slide. Okay. So, what will happen when you use Sudan red color? It will show orange color, and oil red will show red appearance, red color. Osmic acid you will show the fat area will show black appearance, and Sudan black B also will give black color. So, you have to remember the names of the stains used to demonstrate the fat substance, lipid substances within the hepatocytes. So, remember Sudan red, it will give you orange color and appearance. Oil red color will give you red color in an examination. Similarly, osmic acid will give you black color, and Sudan black B will result in black color. Okay. Remember the color of development, the chemical stain used to demonstrate the fat. So, as we morphologically we have seen the three different categories of the alcoholic liver disease. One of them is alcoholic steatosis. In case of fatty liver, how the gross appearance of the fatty liver will have? Liver is enlarged. We have seen in the previous slide. Enlarged liver with yellowish color, greasy in appearance, and firm with smooth and glistening capsule. So, this is how you have to describe a gross morphology of the fatty liver. Say it will be enlarged, hepatomegaly will be there. There will be greasy, yellowish greasy appearance because of increased fat accumulation. The external surface will give you the greasy appearance, yellowish greasy appearance, and from with the external surface will have a smooth and glistening capsule. Okay, and madam class la hai. Yes, madam. Yes, madam. Yes, madam. Radiation oncology room. Okay, madam. ठीक है madam. Okay, madam. Sure, madam. So, this is a gross microscopy, gross appearance of the fat liver, and microscopically, as I told you, you will see able to see the microvesicular deposits of fat and macrovesicular large droplets of the fat. Sometimes you may see fat cyst, and sometimes it elicits granulomatous response also. Means because of fat substances, when they comes into the external surface, our immune system, it generates chronic inflammatory response resulting in granuloma formation. Granuloma is nothing but there is a collection of epithelioid histocytes. How these epithelioid histocytes are formed? they are found from our circulating monocytes. When they reach to the tissue area, systemic area, they will become macrophages. So, there will be a functional difference in the activity of the monocytes. Here normally the normal function of the monocytes is phagocytic function. Okay. So, once they become transformed into epithelioid histocytes, there will be switchover of the functional activity. So, what they will acquire newer function is secretory function. In case of granuloma formation, you might be knowing the granuloma pathogenesis. So, the normal phagocytic function of the macrophages will change to the secretory function by secreting TNF alpha, interferon gamma. So, all those things, the functional activity of the histocytes will become changed in case after they become, once they become the epithelioid histocytes. Okay. So, that is where how you see with the lipogranulomas, when they collection of the epithelioid histocytes surrounding the adipocyte substances, where fat substances, you call it as lipogranulomas. Okay. So, what are the other changes you see? There will be in case of alcoholic hepatitis, inflammatory changes. So, as it may occur directly, or sometimes it may, as a next stage, the coming after becoming steatosis stage, it will slowly progress into the hepatitis stage, and then it will progress into fibrosis. So, how this during the process of hepatocyte swelling, what are the changes? I have already discussed during the acute hepatitis, what are the changes will happen? There will be increase in size of ballooning degeneration of the hepatocytes will happen, and then these swollen hepatocytes will with the clear side ballooning, clear cytoplasm will also have, and some of them will show accumulation of the cytokeratin filaments, and these forming eosinophilic cytoplasmic inclusions called as Mallory bodies. These Mallory bodies are named after the scientist name Frank Burr Mallory. So, okay, he is the scientist who identified these eosinophilic inclusions within the eosinophilic cytoplasmic inclusions Mallory bodies. In the next slides, I will show the images how it look. And then as a result of inflammatory evidence, you will find more good number of neutrophils surrounding the necrotic hepatocytes. So, as an inflammatory response, the cells will get damaged. Once the cell gets necrosed, so automatically it attracts by sending various chemoattractant factors, it results in accumulation of the first policeman, that is a neutrophil, into the site of injury. Okay. So, you will find plenty of neutrophils around the damaged liver cells. So, resulting in collection of the neutrophils, and then lymphocytes also. And then another next step is fibrosis, or the fibrosis starts around the perisinusoidal areas and pericellular areas, giving rise to the appearance of a chicken wire appearance, also called as pericellular fibrosis. It usually starts from the zone 3 area, you know, the area surrounding the central vein is zone 3. So, these are the various stages, and this is a histopathology picture photograph using hepatocyte enlargement of the hepatocytes with balloon degeneration. This is called as hydropic change with clearing and accumulation of the fat substances, feathery degeneration or whatever, granular degeneration is there with each hepatocytes. And you can see that these various clear spaces are nothing fat spaces, these are of macro spaces, macrovascular status, and what they have done the pushed the nucleus to the periphery, and then they have a certain few of the cells will show pink eosinophilic hyaline cytoplasmic inclusions called as, these are called as Mallory bodies. Okay. And the sites of damaged cells, you are saying polymorphoneutrophils, this is a collection of the inflammatory response. So, just next to the progression to the alcoholic inflammation, hepatitis will progress into fibrosis, and then ultimately going into formation of the cirrhosis, alcoholic cirrhosis. So, as I already told you, if you find nodules of less than 3 mm in size, it is comes under micronodular cirrhosis. If nodules are of more than 3 mm in size, it is macronodular kind of cirrhosis. So, what will happen in alcoholic cirrhosis? This is the gross photograph of the liver showing numerous nodules of less than 3 mm in size. This is a kind of gross appearance of a micronodular cirrhosis. Okay. You can appreciate the multiple nodular spaces over the external surface. Similarly, if you find the size of more than 3 mm size becoming, you can see mixed type, means like you can show both, you can identify a nodule of size less than 3 mm also in this case. So, it is a kind of mixed appearance having both micronodule as well as macronodule. So, overall it becomes under macronodular cirrhosis. Okay. So, you will have nodules of more than 3 mm in diameter, the size of color will be of brown, non-fatty in nature and shrunken, because you will find more fibrotic development of change of, and liver gets shrunken compared to the initial stages of alcoholic steatosis and hepatitis. The liver size becomes little bit shrunken during the course of development of cirrhosis. Okay. This is how it appears. So, another gross photograph of this cirrhosis to appreciate of size of nodules of variable sizes and gross appearance of both micro and macronodular kind size. So, micro photograph of the cirrhosis also you can see, as I told you, that you can understand the definition of the cirrhosis here. What you are finding is the normal histological architecture of the hepatic parenchyma is completely lost. Okay. That is the basic step 1. And then you see development of fibrotic septae. Okay. There are numerous fibrosis area dividing into each these regenerating liver nodules. Okay. So, there are regenerating nodules separated by various fibrous sizes thick bands of thick fibrous septae. So, this altogether loss of architecture, finding of fibrosis with regenerating nodules, all these 3 together combined together form cirrhosis. Okay, understand? So, some special stains that is hematoxylin and eosin stain. Here we use Masson trichrome, which it gives blue color with the fibrous bands. Okay. So, as a result you can appreciate the various liver parenchyma nodules separated by the thick and thin bands of the fibrous bands, blue colored bands. This is a Masson trichrome. Okay. This is how you demonstrate the fibrotic bands in the liver parenchyma. So, now coming to the, after knowing about the gross and this pathological features, now we will discuss a few points regarding the clinical manifestations. So, clinically, you already discussed in the previous classes with all of your participation. So, what will you see when you examine a patient with alcoholic steatosis? Clinically, he will have enlarged liver, that is hepatomegaly, and there will be mild elevation of the serum bilirubin levels and alkaline phosphatase. Okay. So, you have to remember. So, in this alcoholic steatosis stage, you have enlarged liver with mild elevations of the serum bilirubin and alkaline phosphatase. In the second stage, alcoholic hepatitis, what will happen? There will be, after having a acute heavy bout of alcohol drink, patient will have a hepatitis features, clinical manifestation, prodromal clinical manifestation of malaise, anorexia, upper abdominal discomfort and tender hepatomegaly. Because of inflammation, he will have a tender hepatomegaly. So, this is how a clinical manifestation, and when do liver function test will show increased bilirubin levels, hyperbilirubinemia and elevated serum aminotransferases and alkaline phosphatase enzymes, that you have already known. So, in case of alcoholic cirrhosis, patient used to clinically present with weight loss, anorexia, weakness and hepatic failure. Okay. He will also have elevated liver enzymes, hyperbilirubinemia, hypoproteinemia, decreased proteins in this thing, and anemia. So, and as a result of complications also he may develop portal hypertension, ascites. So, portal hypertension we will do, we'll further we will know about the portal hypertension. Ascites is accumulation of the more amount of free fluid in the peritoneal cavity, that is ascite, more than 500 ml like that. Okay. That classification, various classifications are there, amount of depending upon the quantity, and as a result of portal hypertension, patients tends to develop portosystemic venous shunts. Because of fibrosis, there will be alterations in the venular drainage or systemic vascular drainages. As a result, they alternate blood supply, they try to develop alternate blood circulation, resulting in form of irregularly thickened vessels called as varices. So, there are different sites where you try to see the presence of varices because of increased portosystemic venous pressure, portal hypertension. So, we see the development of various vessels and at different locations, and GE junction is gastroesophageal junction is one of the most risky site for in the case of as a part of complications of portal hypertension. Esophageal varices is one of the dangerous site. Other sites are rectum, umbilicus and retroperitoneal. So, in the umbilicus you have seen the formation of caput medusae. So, surrounding the umbilicus they will try to form like snake like structures. The vascular prominence, enlargement of the vascular architecture will be seen surrounding the umbilicus. Okay. That is described as caput medusae. Okay. And retroperitoneal areas also they will try to give the development of portosystemic venous shunts. And as a result there will you also see similarly simultaneously you will see there is enlarged spleen also called as congestive splenomegaly status, and then because of abnormal metabolisms in the urate the excessive ammonium will be formed. As a result this you will see patients presenting in form of hepatic encephalopathy. Okay. So, these are the various clinical manifestations of the liver disease. So, why patients of this liver cirrhosis death results in various causes of death in case of advanced alcoholic liver disease. It is an end stage of liver disease. As a result, at the end stage of liver disease, patient may try to manifest various forms in the form of hepatic coma. As a result of as a part of complications of hepatic encephalopathy, patient might present with a coma state. In unconsciousness, they will incoherent. Okay. So, patients will present with hepatic coma, that is called as hepatic encephalopathy. And massive gastrointestinal hemorrhage, as I already told you, the GE junction at the varices will they get broke down and result in excessive hemorrhage, loss of blood supply, sudden heavy loss of blood result in coma and shock, and then they will go into death also. That kind of variceal bleeds are there, very dangerous. And intercurrent infections, as I told you, because of increased inflammatory chances, there will be a decreased immunity, there will be a higher chance of getting into intercurrent infections also. And then hepatorenal syndromes, you know the various reasons of increased vascular resistance. These renal failure, along with the liver failure, it also results in renal failure also. There will be decreased glomerular filtration rate. As a result, there will be increased sodium content within this thing, and body tries to develop alternative mechanism. As a result of development of increased peripheral vascular resistance, and it results in renal failure. Like means there will be decrease in GFR. And the functional activity of renal kidney will get lost, there will be decrease in renal function resulting in hepatorenal syndrome. And finally, this cirrhosis may progress into hepatocellular carcinoma. So, these are the various causes of development, various causes of liver disease which will present with an advanced state of the liver disease, alcoholic liver disease. So, coming to this, once again to repeat, so you have to remember in the pathological manifestations of the alcoholic liver disease into 3 steps. One is alcoholic steatosis, second stage is hepatitis, and then fibrosis. So, in the first step, alcoholic steatosis, what is the mechanism for development of more amount of the fat substances? Okay. So, what are the various mechanisms you have to remember of increased fat substances formation, fat metabolism? So, these important steps you have to remember in the conversion of alcohol to acetaldehyde, the enzyme activity with the help of alcohol dehydrogenase, we will see increased formation of NADH. So, and this acetaldehyde will be converted to acetic acid. This is in the liver parenchyma. So, there will be alteration in the ratio of, we will see more amount of increased NADH formation compared to decrease in NAD substances. So, this reversal will result in suppression of fatty acid oxidation, and there will be increased fatty acid synthesis also, impaired lipoprotein assembly and secretion. Okay. So, all these 3 factors together results in accumulation of fat within the hepatocytes. Some other external mechanism also I told you, there will be increased peripheral catabolism of the fat resulting in increased pool of the circulating pool of the fat substances. Okay. So, all this together results in accumulation of the fat in the hepatocytes resulting into steatosis. Second mechanism you have to remember is what are the how the stages of alcoholic hepatitis will happen. Okay. Once you have understood the mechanism of alcoholic steatosis, now understand the alcoholic hepatitis mechanism. So, what do you means there will you have to understand the increase the formation of acetaldehyde, there will be formation of newer chemical products, newer antigens. So, what will these chemical adducts will do? They will try to form a new antigens over the hepatocellular surface. So, identification of the newer antigen as a foreign body. Okay. So, as a result our autoimmune once individual's autoimmune response will gets activated resulting in liver damage. Similarly, the protein adducts and various cytochrome P450 enzymes, importantly the cytochrome P2E1 enzyme you have to remember, it results in increased generation of the reactive oxygen species. Another thing is get activated by because of inflammation. So, I told you various causes of inflammation of the hepatitis, and then as a result what will happen, inflammation to the endothelial cells as well as the other Kupffer cells, stellate cells. What they do happen, once they are getting inflamed, they will release certain cytokines like tumor necrosis factor alpha and then tumor growth factor beta. So, all these factors will try to stimulate the stellate cells. Okay. After getting stimulated by this inflammatory secretion, so what they will become? They will try to become the fibrogenic cells. So, they are fibroblasts, they become fibroblasts with property, they will acquire property of contractile myofibril contractile property. Okay. So, what they do, fibrogenic cells will result by laying down increased secretion of the type 1 and type 3 collagen substance in the damaged area. So, as a result it will try to fibrosis. Another mechanism they explained is because of increased myofibroblast contractile property, they try to constrict the sinusoidal vascular spaces. So, upon constriction what will happen? There will be increased vascular resistance, there will be hypoxic environment created. Decreased vascular supply and hypoxic environment, they gradually progress into the fibrosis. Deranged perfusion will result in fibrotic process. Okay. This is how the various mechanisms you have to remember with the alcoholic liver disease. Okay. Thank you.
Number 1, 2, 3, 4, 5,
Okay. Recording system. Thank you.